Good day, I am Jenny Ann P. Sabalsa, AB Literature First Year College student. Before I proceed on how to eliminate sexually transmitted disease, let me first define sexually transmitted disease or STD. Sexually transmitted diseases or STDs are generally acquired by sexual contact. The organisms such as bacteria, viruses, or parasites that can cause sexually transmitted diseases may pass from a person to person in blood, semen, or vaginal and other fluids. These diseases are passed through intimate physical contact such as heavy beating and from sexual activities including vaginal, oral, and anal sex. Anyone who is sexually active get an STD. Some groups are more affected by STD and their outcomes.
Adolescent young adults, gay, bisexual, and other men who have sex with men, pregnant women and infants, racial and ethnic minorities. Here are the signs and symptoms that might indicate an STD in close. Sores or bumps on the genital or in the oral or rectal area. Unusual or odd-smelling vaginal discharge. Unusual vaginal bleeding. Pain during sex. Next, lower abdominal pain.
Students, here are how to eliminate sexually transmitted diseases or STDs. First, practice abstinence.
The shortest way to eliminate STD is to not have sex. This means not having vaginal, oral, or anal sex.
Second, use condoms if you're having sex.
Using a condom correctly every time you have sex can help you avoid STDs. Condoms lessen the risk of infection for all STDs.
Number three, have fewer partners.
Reducing your number of sex partners can decrease your risk for STD. It is still important that you and your partner get tested and that you share your test result with one another.
Number four, talk with your partner.
Talk with your partner about STD and staying safe before having a sex. It might be uncomfortable to start the conversation, but protecting your health is your responsibility.
Number five, get tested.
Talk with your healthcare provider.
Students, let raise awareness about what is sexually transmitted disease, infection, or STD, STI are, and how they impact our lives. And that's why it is important to prevent, test for, and treat them. Always remember that prevention is better than cure. Lack of knowledge about STD among students becoming more sexually active at a young age tends to increase a person's number of overall partners and as a result, her risk of STD. My dear students, awareness will always be a must. So much for STD awareness. Now let's proceed to 10-week pregnancy awareness. Before I discuss how to eliminate 10-age pregnancy, let me first introduce what is 10-age pregnancy. 10-age pregnancy, known as adolescent pregnancy, is a pregnancy in female under the age of 19 or younger. A woman can get pregnant if she has a vaginal sex with a man at any age she's begun having regular period. Having a baby in your 10 years is very stressful. You will have to get a job, babysitter, and still try to manage to go to school. Here's always the question. Why does 10-age pregnancy occur? The number one reason why teenage pregnancy occurs is unprotected sex. Second, non-use or improper use of birth controls or condoms. Third, peer pressure. Number 4, drugs and alcohol. Now, let me share to you, my dear co-students, how to eliminate teenage pregnancy. First, abstinence. Second, parents must guide their children. Third, use contraception. But most importantly and effectively, do not do premarital sex. Students, let's raise awareness to teenage pregnancy. Remember, it remains as a major contributor to maternal and child mortality. Complications relating to teenage pregnancy and children are the leading cause of death for girls at the age of 15 to 19 globally. Pregnant adolescents face other health risks and complications due to their mature bodies. A co-student reminders, be mindful, raise awareness to this common issue. Prevention and awareness must be applied. My dear youth, if you ignore this issue, what about your future for tomorrow?